Hi everyone, it's Dr. Monica Bonakdar, and today I'm going to answer a commonly asked question, which is what's the difference between the 5 different Juvederms available? Before I do that, I'd like to introduce you to the newest member. This is Volure, and it's the first and only long-lasting FDA-approved filler for moderate to severe folds and wrinkles. This is a great product for people who don't want a lot of swelling after they've done their filler, and it's ideal for nasolabial folds and lower part of the face. So back to what's the difference between these 5 products. I'm going to use 2 food analogies. So the first analogy is think about a box of Jello powder, and when you mix it with water and stick it in the refrigerator, or before you stick it in the refrigerator, you add some more gelatin so that it's a harder Jello, almost like gummy bears. So when the powder is mixed with the water, that's about the consistency of Volbella, which we use for fine lines in the lips, over the lips, or very mild lip augmentation. When you stick your Jello in the refrigerator and it becomes somewhat hard, that's like your Volure. It has a shape to it, but if you push against it, your finger will kind of go into the Jello, so it's soft. Voluma, on the other hand, is the hard one that somewhat resembles bone, and it's as if you push against the gummy bear and it pushes back at your finger. So that's the consistency of these 3 products. So you can tell that I would use it for different parts of the face and different skin thicknesses. Voluma we use for cheeks, Volure on the lower part of the face, and Volbella for lips. Now, my next food analogy is to explain Juvederm Ultra and Ultra Plus, and it has to do with pasta. Imagine a box of uncooked pasta. Now imagine what happens to it when you actually cook the pasta. It absorbs water and expands in volume. That's what happens with Juvederm Ultra and Ultra Plus. They once injected, expand beyond their volume to between 4.5 to 6 times as much. So we use these for parts of the face that are volume deficient to economize, so that we don't have to use as many syringes of filler. So when I do a facial assessment, I am determining the parts of the face that are deviating from the beauty standards, and then also determining which products to use and in what quantities. It's rare that I only use one product for the face when I'm doing a full facial rejuvenation. Very much like how a chef will mix different ingredients to make the best food possible. I have multiple ingredients in my possession to do the most natural and beautiful job possible. So thank you for watching, and I hope this was helpful.